Good morning. How is everybody? Yeah, I'm tired too. Let me let people know where we are. I have my coffee. Super important. Yeah, I did. I woke up like an hour ago, so it's Sunday. I don't have to be places. At least not this Sunday. So we will talk about all the healthy things in pregnancy while I post this link on Twitter. All of the tech. I'm learning all the tech. It's fantastic. So as people join, let me tell you a little story. I think I mentioned before about meeting my neighbors. So I did. Well, kind of. One of my neighbors met me, is really how it went. Our driveways are next to each other, right? So I live in a complex where that's a thing. And I think I was getting into my car and she was actually getting out of her car and going to her door. It was like simultaneous. So I said, hello. And she said, hi. And I kind of just looked at her and I was like, have we met before? And she said, I don't know. But I thought, okay, that's interesting. Because I don't know either, because I have a bad memory for that sort of thing. But I swore I hadn't met her as my neighbor yet. So I was just trying to, ease into an introduction. And she said, I don't know. And I said, oh, well, I'm Leah. And she said, nice to meet you. And she walked into her house. Which left me wondering, like, what? I mean, she was like early 20s, mid 20s, maybe. I don't know if that has anything to do with it, in case you had a different sort of idea of her in your mind. But I was confused, and now I'm like afraid to talk to her because it seems like she doesn't want to know people who live next door to her and could possibly be helpful should she need help one day. So that's interesting. And then, last night went to see, as I'm sure some of you saw on Twitter, BlacKklansman. Does not disappoint. And I don't say this about a lot of things, regardless if it's movie or book or whatever. This, I feel, is very much required viewing for everyone in this nation specifically. I think a lot of other nations have progressed a lot farther than we have regarding racism and social oppressions and hatred and bigotry. And so I think that regardless of where you think you are in the realm of things, and I'm not racist, and I'm not, that doesn't apply to me. No, you need to watch it. Everybody needs to watch it. It was amazing. And good morning, Albert. It was really amazing. BlacKklansman, required viewing for anyone, especially anyone in these United States of America. BlacKklansman is what you need to watch. I posted about it last night. I didn't post very much because it was it was a lot, and it was very emotional, and it was a lot. And bravo to Spike Lee for all of the feels and all of the amazingness. Yeah, I had posted about it. So, all right. So we can, now that I've gone over the non-meeting of my neighbor and, rewatch the video or whatever, but BlacKklansman, again, amazing, must see. We can get into pregnancy and how to have a healthy one. I think that a lot of people have a lot of questions that aren't easily answered. And please don't ever go to WebMD for answers. Just call your doctor for answers. That's a thing, by the way. Many people don't think about calling their doctor just to ask a question. I've had my own friends and family say, "Oh, I didn't want to bother you." No. That's my job for you to ask me questions. You're supposed to call my office if you have a question so that I can answer it and get back to you, so that you're not somewhere that you don't want to be in urgent care and ER if it's not necessary, or if you do need to go and you're not there yet. That's very important. So please don't hesitate to call your doctor or your nurse practitioner, your PA, or whoever's taking care of you when you have questions about your health. That's for anybody. Don't go to WebMD. Bad. So first thing, I guess, you want to plan the pregnancy. The planned pregnancies are the healthiest pregnancies. So when you are preparing to get pregnant beforehand, you're probably using some form of contraception. The birth control pill, condoms, the IUD, the shot, the whatever. Hopefully you are using these methods, and preferably the higher effective methods that are the IUDs or the implant. The shot is also right up there at 94% efficacy. You're using these methods before you decide to stop these methods, and especially with the IUDs or the implant, once you remove those methods, you are immediately as fertile as you ever were. So unlike hormonal contraception such as the pill or sometimes the Depo shot, you can have a month or two of where your body's like, oh, now I'm going to make an egg. The IUD removal and the implant removal gets you right back to whatever your cycles were before, and your eggs were always going to be coming right after. So that's a thing, especially if you're going to plan. Don't think that there's going to be like 6 months of not getting pregnant. If you need 6 months, then still use those methods for those 6 months and then remove them. You want to take folic acid. That's the magical part of the prenatal vitamin. So not a lot of people can tolerate prenatal vitamins. It's a lot. It's heavy on the stomach. You want to make sure that you're getting appropriate nutrition anyway. However, the key thing that us OBGYNs worry about is the folic acid. And while that is supplemented in our foods, we want you to at least take a vitamin daily of folate or folic acid. So you want to start that about 3 months before, a month before. You have it on board at least before you get pregnant. This is all to say, like, this is an ideal situation. This is not, if you don't do it, you're going to have an unhealthy pregnancy. I hope it's understood that that's not what I'm saying, because we've gone millennia without folic acid and still had babies and still continued to populate the earth for lots and lots of years. So this is just the ideal situation. Other things people ask about are vaccinations. You want to make sure your vaccinations are up to date, especially measles, mumps, rubella. That's a vaccine that can't be given in pregnancy, so you want to make sure that you have it confirmed that you're immune to rubella beforehand. So I usually do a blood test before, when people come to me saying I'm going to get pregnant, I'll check to see if they're immune to rubella before they get pregnant. And if not, then ideally they get the vaccine. We wait a few months and then they get pregnant. We check for that immunization during pregnancy as well. It's not a common disease anymore, rubella, so not really anything to worry about so much. But if you don't have immunity when we check during your pregnancy, then we will want to give you the measles, mumps, rubella vaccine after you give birth. So that's also important. Let's see, the other things, medications. Very important to ensure that the medications that you're taking are safe in pregnancy. The best way to know is to call either your OB or your midwife or your nurse practitioner, whoever, who's taking care of you, or the prescribing doctor. Coffee break. The prescribing doctor should know if it's safe in pregnancy. And if it's not, the prescribing doctor is often the best to decide what to switch it to. So I often have patients come in and they're taking medications that are not appropriate for pregnancy. And maybe they are for depression or for bipolar disorder or whatever. I'm going to want to actually speak to their prescribing doctor and decide how we're going to wean them off of the one medication and get them therapeutic on another medication before pregnancy. Ideally before pregnancy. That doesn't always happen. Sometimes it's during pregnancy and you just work with what you got. So that's a thing, and doctors should be talking to each other. You know, healthcare providers need to communicate regarding patient care. That, I don't know why, seems to be a foreign concept to a lot of folks. I don't know if it's because people just don't know these things happen, or I don't know. I've called other providers and they're kind of surprised, like, oh yeah, we should coordinate. And I'm like, well, of course we should coordinate. It's what we do. It's how we provide optimal care. So you should have your healthcare provider's information on you so that your OB or your pregnancy provider is able to contact them expediently and able to provide the best therapeutic medications during pregnancy, and knowing what the plan is so everybody is on board. And it's not good for someone, honestly, like, I don't like to put the onus on my patient to communicate to their other doctor what the plan is. That's not good, because people don't really know medicine unless they're doctors, right? Like, well, healthcare providers. So, you know, for a patient to have the responsibility of saying, okay, you're my healthcare provider over here, and this other healthcare provider said this, so that's what the plan is. Things can get lost in translation and things can get lost. So really, communication between providers needs to happen. Yes, communication is super important. So then you have activities during pregnancy. People often ask, you know, I'm a runner, and so when is it okay to, you know, run? And am I allowed to run anymore? Do I have to not run? And the activities in pregnancy is really mostly common sense. Running is fine. You're hopefully, you know, eating and taking in nutrients, and so exercising is perfectly reasonable. There will come a point where running is going to be unsafe because your body will have changed such that the growing pregnancy will actually change your center of gravity. This happens to everybody. So walking might be the safer way to do that, walking at a fast pace, but at least walking and not so much running, because you don't also want to stress out your joints, pull muscles, have back problems. It's a lot of stress on your body to carry a pregnancy. I'm sure is not a surprise to anybody. So when you are, you know, growing in pregnancy, you'll kind of feel, oh yeah, so I need to tone it down a notch. Also, because of the change in your center of gravity, things like bike riding might not be so safe. I would not recommend mountain biking. I would not recommend rock climbing. I would not recommend any of these things that just kind of don't make sense anyway in your second or third trimester of pregnancy. But things that are within reason and kind of are commonsensical, then, you know, exercise is good in pregnancy. It has to be the appropriate exercise. Certain forms of yoga are fine, you know, certain positions and poses. The best way to know is to ask your healthcare provider. Just a quick phone call, sometimes email. I don't know, people communicate different. I prefer phone calls. I don't trust email. I am terrible at checking it, so phone calls are best. And let's see, what else? I don't have, let me just check the Twitters to see if there's anybody responding there with questions, because I usually have a few questions from folks, and it seems like not really. And it's Sunday morning too, so I am just trying to get out some good information, even if there aren't many questions. Let's see, what other things do people ask me? Foods. That's a good one. Foods are, there's a, if you go to patient resources on like acog.org, acog.org, there's some okay foods and not okay foods. In general, they say deli meats, avoid deli meats. Yes, it's safest. The concern with deli meats specifically is a bacterial infection. So you don't want to get food poisoning, namely listeria. That can actually harm the fetus as well. You want to make sure that, anything you eat is properly processed. So that's the concern there. Tuna, generally a can of tuna a week is fine. That, of course, there is concerns for mercury levels. The other fish that have tuna doesn't have a high content, but it's just safest to limit to 1 can a week. Other fish that might have a high mercury content, we don't consume here in the United States. Some type of shark and something or other, I can't remember. Anyway, it's generally found in sushi, and we don't generally have that type of sushi here in the United States. So then, yes, Albert, 1 second. So fish, and then the dairy, again, sort of like the soft cheeses, that's again a concern for bacterial infection. I think just making sure that the foods you consume are properly processed. If you can avoid things that should be avoided, great, because you just reduce your risk of an infection that can be harmful to you and the baby. And that means, making some sacrifices. So, like having children often involves. The other concern, how much food? So you're not eating for 2. That's you'll gain weight during pregnancy, and the pregnancy will take from you what it needs. So don't be worried about that, and don't overeat because you're thinking, I have to feed a whole nother entity. I'm growing this human being, and so they need to eat like I need to eat. It doesn't work that way. The baby will take from you what the baby needs. Eat what you feel is appropriate. When you're full, you're full. If that means later on in pregnancy, because you have your belly growing, and that means your stomach doesn't have as much room to expand, just like your lungs don't have as much room to expand, maybe you eat smaller portions throughout the day more frequently than the typical breakfast, lunch, dinner that we do here in the United States. So you're not eating for 2. The baby will take what the baby needs, and you just eat kind of as you normally would. You'll increase just naturally your caloric intake for what you need. That's how that works. That's just your physiology will help you there. So please don't try to eat for 2. That will create unnecessary weight gain if not careful. I want to answer Albert. I saw in one of your tweets that one of the Twitter individual replied about the Death of a Nation movie. And have I heard of it? I've never heard of or seen it. I've actually not heard of it nor seen it, and I should look into it because that's clearly a counter film, I guess, to Birth of a Nation, which is a highly racist, scary, horrible thing that exists in the world. So I should definitely look that up. Again, BlacKkKlansman was just, I'm still processing, and it was so powerful. Everyone needs to see it. Spike Lee, how do you do it? Yeah, man. So let's see. Oh, back to pregnancy, and activities, food, sex. Having the sex during pregnancy. People ask about this, right? Of course they do. You should have the sex during pregnancy. Sex is healthy. Having sex is very good for people. Orgasms specifically are good for people. That releases hormones, specifically oxytocin. That helps relieve stress, increase bonding. You're not going to hurt the baby. Now, there are situations where such sexual acts as penis inside vagina or something inside vagina might be recommended against. Pregnancies that involve a cervical cerclage, for example, we don't want anything going inside and disrupting the stitches because the cerclage is there to help prevent preterm birth. So in those types of situations, you might have instructions from your healthcare provider about not having penis in vagina intercourse. That said, there are many different ways to have orgasms that don't involve penis and vagina intercourse, right? We all know this, I hope. So be intimate with your partner. Be not afraid of engaging in sex and bonding and all of those good things that help a relationship. The only caveat would be if you have specific instructions. By the way, bed rest is not recommended ever, really. We have shown that people who are put on bed rest actually have worse outcomes in their pregnancies because guess what bed rest does? It stresses people out. Telling people to not do anything is stressful. So, while we want folks to, in some cases, be careful or more careful about their activities and what they're doing, we don't want people laying in bed for weeks on end. That is not recommended. So, even folks in the hospital, we want up and walking around and making sure that their daily routine is, not terribly altered. Obviously, if you're in a hospital, that's all sorts of a different scenario, but we don't want people lying in bed 24 hours a day, 7 days a week, weeks on end. Like, that's not good for the pregnancy. It's not good for general health. It's not good for mental state. So be wary of that, because I know that there are still some healthcare providers who might say, oh, yeah, bed rest, which is different from pelvic rest, which is what I mentioned before about the nothing inside the vagina. That's pelvic rest. Bed rest is laying in bed all the time. We don't want that. Let me see. So having sex is good. And I wonder if people have questions about the whole birth process. I think that when people are pregnant, they're afraid to ask what is allowed in a hospital or wherever they're giving birth. Hopefully it's a hospital. I'm a hospital advocate. We used to have a lot of home births because we didn't have hospitals, and we also had a lot of bad outcomes as well. My Australia mug. I like mugs. Mugs are awesome. So I have patients all over the spectrum of desires as far as what their birth experience is, and I'm happy to work with my patient on that. I have a few things that make me comfortable and that I would prefer. My patients have things that they would prefer. Anywhere from, am I allowed to walk around? Yeah, you're allowed to walk around. As long as the baby's doing fine, we can take you off the monitor for a little while. You can walk around and have your freedom for a little bit, and then we'll get you back on the monitor. I think that's reasonable. That's how I practice. Not everybody is like me, and I'm not like everybody else, but there are, stipulations during labor that I think can be reasonable and in play when talking about what the birth experience will be like. Another question, do I have to have an epidural? No, you don't have to. You don't have to do anything, really. It falls under the autonomy spectrum, right? So if you don't want an epidural, you don't have to have one. If we need to do an emergency C-section, that might mean we put you to sleep instead of just numb you more, that sort of thing. But, I discuss that with my patient. I personally recommend epidurals. For one, contrary to popular belief, they're not anywhere near the spinal cord. So that's not a thing. That actually the medicine is dripped along the fatty tissue that's outside of the spinal fluid and spinal cord. That's why it's an epidural. It's above the dura. So it's, there's some fears there. It's sort of like, I wouldn't want to have surgery without anesthesia. Childbirth, I understand, is very painful, so it's an anesthesia for that procedure. So I'm a fan of it, but not everybody is, and that's fine. IV fluids. Right, so you're hooked up. Basically, when you go into a hospital and you're a patient, we kind of trap you. We take your clothes, you get in a hospital gown, we hook you up to things that are stuck inside your body. There's a reasonable explanation for all the things we do. Eating during labor, we obviously, as a species, have done it and do it and whatever. The concern there is if an emergency happens and we need to put a tube down your throat because we need to put you under anesthesia to sleep, if there's food in your stomach, that could be vomited and then you could inhale it, and that's aspiration pneumonia, and that's really, really dangerous and can actually kill people. So we're trying to mitigate various risks when we have certain rules in the hospital, like you're not allowed to eat when you're in labor. You can have ice chips, you can have water, you can have something that's quickly absorbed in the stomach. But like a heavy meal, we don't necessarily want you to have. Hello, NJSO. Let me answer your question. I'd like to know, in your experience, what is the more frequent long-term consequence of giving birth? I've heard cases of urine leaks or painful sexual relations. Is there statistics for that? That is a good question. And I think that the research that we could have on that would be very difficult to really obtain, because when you say urine leaks, that, for example, that's urinary incontinence, that also happens with the natural aging process. So for any sort of long-term study, it would be difficult to say, oh, is this attributed to childbirth, or is it attributed because there's tissue breakdown from just getting older? That's hard to separate out. So yeah, there's data, I guess, but thing like urinary incontinence, I've never given birth. It can very well happen to me as I get older. So that's a thing. But specifically to childbirth, yeah, it can happen. That's one of those things that is a risk of childbirth. Other long-term consequences of giving birth. You're a parent. That's a long-term consequence. You can place the child for adoption, of course. That can also be traumatic and emotionally difficult. So I assume that you mean vaginal birth, because then there's C-section, right? So C-section birth, you have a scar and you have changes in your skin, right, from the scar. You also have changes in your skin from the growing belly. You have changes in your breast tissue from developing mammary glands that are active and you're lactating. Whether or not you have an infant that you put to the breast, you still produce milk. Breast tissue actually changes with full-term pregnancy and giving birth, such that those folks who don't go through that process have immature breast tissue. So I have immature breast tissue because I've never given birth. I've never breastfed. So my breast tissue is actually different from those who have given birth and or breastfed. That actually puts me a little higher risk for breast cancer. That to me is not enough of a reason to have a child in my uterus. I'm not going to be giving birth so that I can reduce my risk of breast cancer. But that is a thing. My breast tissue is anatomically and physiologically different than someone who has given birth. So that's a change. Sexual intercourse, vaginal birth, for example, the vagina is very resilient. You can tear, of course. Hopefully the repair goes well and the vagina returns back to normal as it ever was, right? Like, you should have the vaginal tissue, while it has stretched, it also returns back to size. And hopefully any repairs don't break down, there's no infections there, and your tissues heal back normally. With vaginal births, there is a degree of tearing that we use. There's a little tear and then all the way to a great big tear. Little tear is first degree, great big tear is fourth degree. A fourth degree tear goes into the rectum. So when giving birth, there is, of course, a risk that you not only tear the vagina, but also tear down into the perineum. That's the second degree. Then you tear down into the anal sphincter, the external anal sphincter, and that's a third degree. And a fourth degree is when you go even further in the tear, and that's into the rectum, and that has to be repaired. There can be consequences of anal incontinence from that type of tear, and hopefully that doesn't happen with a good repair, but even with a good repair, it can happen. So giving birth carries a lot of long-term risks that you can't foresee, you can't predict. If you need a C-section, there's all the risks that come with surgery, because that's a surgery. It's the most common surgery we perform in the United States of America, but it's still an abdominal surgery. And any risk of surgery, infection, bleeding, injury to other organs, pulmonary embolism from blood clots after surgery, those types of things, aspiration, as I mentioned before. Those types of things are all risks to surgery, to having surgery. So not even necessarily related to childbirth, but then you've got childbirth, and then you add a C-section, which is all the risks of surgery added onto that. People often say childbirth is natural. Yeah, it is. It is natural for a percentage of the population. So half of the population, and then whatever percentage is actually fertile. Sure, it's natural, but it has a lot of consequences, and other things that are natural are called bacteria, and they cause infections, and there's cancer that's also natural. Healthcare in general is a fight against the natural order of things. So my entire profession is about trying to stop what might be natural processes from occurring so that people can live longer and feel better. And if you think about it, that's what medicine is. Let's see. Yeah, so right, Albert, it can be a positive or negative consequence depending on the situation. I think that people have very different, wide variety of feelings on childbirth itself as well. Some people love it, love giving birth. That's awesome. I can't really relate to that really either way because I've never given birth, but other people hate pregnancy and they hate giving birth, but they love the outcome. They love their child, of course. They love raising a child. They love watching that child grow into an adult and do all of the things. And that's great too, obviously. Like, it's so people have all sorts of feelings about their own pregnancies. It's really interesting. Everybody that I've met has some sort of variation of their approach to their own pregnancy. So it's interesting. Let's see. You're welcome. NJSO. I'm sorry. I assume it's New Jersey. So I don't know. And Albert says some claim that childbirth is a means of reproduction that lowers death rates versus abortion. No, right. So that's Lesai, definitely. Being pregnant has so many risks. Whether or not you have an abortion, whether or not you give birth, being pregnant has so many risks. And for anyone to say to anyone else, this is what you should do, whether it's you should have an abortion or you should give birth, you can't tell someone either of those things. They have to decide for themselves what risks they're going to undergo. And if they choose to undergo all of the risks of pregnancy and childbirth, awesome. If they choose to avoid those risks but undergo the other risks of having an abortion, awesome. That's up to them. Everything has risk. Eye roll. But yeah, abortion in the first trimester specifically carries a lot less risk than carrying a pregnancy to full term and giving birth. Many are quick to jump to, so you're telling pregnant people they should just have an abortion because it's safer. No, that is not what I'm saying. Obviously, what I'm saying is, at the end of the day, having an abortion in the first trimester carries fewer risks than carrying a pregnancy full term and giving birth. That's just a fact. That does not mean that people should therefore do this thing and not this other thing. No. People need to understand that, but oftentimes people are actually getting pregnant so they can carry a pregnancy full term and give birth. And they know those risks. It's not going to stop them from wanting to have a child. That's ridiculous. So, right. And people can twist words around from healthcare providers like me and send a political message. That doesn't change facts. I don't think that anybody should be told what they should do with their pregnancy from the government, from a partner, from parents, otherwise. I think people deserve the freedom to decide for themselves what outcome of their pregnancy that they want. And I also feel that we as a whole society have an obligation and an investment to giving that person every opportunity and resource that they need for whatever decision they make. When we actually invest in maternal health outcomes, we have better neonatal outcomes. When we invest in education of women and children, we have higher economic growth. And we as a nation don't do that. We as a nation are apparently perfectly fine with an embarrassingly and tragically high maternal mortality rate people dying in childbirth, especially people of color. What does that tell you? Yeah. It's horrible, and it's embarrassing, and it's a tragedy that should not ever happen. Sure, sometimes people die in childbirth, not at the rates that they do in this country. Should it ever be that high? Let me read Albert here. Yeah, I mean, I think that we need to open the conversation more. We need to talk about things that make us uncomfortable. I am a white lady, right? And I have privilege, and I get that. And there's no way for me to understand what a woman of color in my similar situation experiences. But what I can do is listen, and what I can do is counter any racist or misogynist or any sort of behaviors or comments that I experience out there. I can actually say, hey, you know, that's not okay. Here's what's really happening. And I think it's a responsibility on my part to do that and to listen to, well, specifically my patients of color, right? So I trained in Philadelphia. I had predominantly women of color coming into my office. My patients were, I think, 90% Black. And I had a few white patients. Like that was my training. And hearing all of the different, I would prescribe a medication and maybe somebody couldn't afford it, so they wouldn't take it. And then they'd come back and I say, why weren't you taking your medication? Now, and I'd get upset. But they would be like, well, it's either get the medication or buy food. And I'm like, whoa, okay. So let's figure out a different solution here, because obviously there's this disconnect. Because I'm coming from a place of privilege where I just go out and buy medication. So it's up to, folks in positions like mine to hear what the reality is and to make sure that our legislators hear about those realities and that they are cognizant of those realities and they're doing something to change those realities. It's really infuriating. It's systemic oppression through healthcare, through education, through so many different things. And it all leads to these outcomes. And especially the higher maternal mortality rate among women of color. We can do better. We need to do better. We must do better if we're human beings and have the slightest bit of humanitarianism in us. What are we doing? What's going on? Let's see. Oh, I just like to know taking supplements during pregnancy is enough to maintain good levels of calcium during pregnancy. I see lots of women aging with osteoporosis. So pregnancy will lower your calcium levels temporarily. After you give birth and after you're done breastfeeding, those calcium levels rise back to what they were before. So it's a temporary reduction in calcium levels. That said, osteoporosis in women as they age is very common. The time to counter that is in your late teens and early 20s. Surprise. But as we grow older, as us women folk grow older, calcium supplementation is good. Weight-bearing exercise is good. That builds it puts the stress on the long bones to increase the lattice work to strengthen them. So weight-bearing exercise, that sort of thing helps counter the risk of osteoporosis as we age. But the time to prevent osteoporosis is when we are young. That's how that works. And again, being pregnant and giving birth, that's a temporary sort of like dip in calcium levels, but it's not a cause of osteoporosis. The same thing with Depo. People have been told, I don't know, decades ago or whatever, that Depo causes osteoporosis. That is not true. Depo may reduce calcium levels temporarily, but they get back to what they were before when you stop using Depo. So you don't need to stop using Depo. You're not going to get osteoporosis by using Depo in your childbearing years any more than you will because you've breastfed or given birth. So that's that thing. Good question. NJSO. It's from your name. Excellent. You're watching from Colombia? NJSO is watching from Colombia. That's awesome. Wow, I've always wanted to go to Colombia. And your name is Nelly. That's a lovely name. I love it. Hello, Colombia. So, yes, Albert, people do need to respect each other and be friendly and not hostile toward each other. I don't understand. I cannot, my brain can't understand why we would go to a place of hate, just blind hate of a fellow human being. It's just a concept I don't understand. And I think that the outcomes of what that does to people is very clear in what we've seen as far as violence in school shootings, in protests, and cars running over people, and I can't even say his name. I can't even say that he's our president. What our president has said or not said. He is enabling and promoting hate and division. And that is something that I just cannot stand, and I will not stand, and I will fight against. And when I say fight against, I don't mean fisticuffs. I mean, I will speak out. I will try and do my best to bring people together and not tear them apart like he's doing. It is not right. No good comes of it. And he gains everything. He gains the power. He gains the power, basically. I mean, that's what it's all about, power and money. And where the power is, the money is. So yeah, don't give in. Don't be divided. Don't allow yourself to be that guy who is hateful, who decides blindly that somebody else's life is not worth living and therefore you can take it. That's not where we should be as a society. Albert says, no idea, we're in the middle of a psychological warfare. No, it's true. Psychological warfare is happening, but I mean, it's obviously something more pervasive than that. If you haven't read On Tyranny, I don't know if I don't see my copy anywhere. On Tyranny, it's 20 points of how tyrannical governments come to be. I think we're about point 12 at this juncture in the presidency that never should have been, but here we are. Read that book. It'll take you a couple hours. It's super quick, but it's super important. That and Sinclair Lewis's It Can't Happen Here, because if I hear one more person say it's not going to happen, it can't happen, so help me, yeah, I might just bury myself in books today and just avoid all of the things that could be going wrong outside because it's just too hard sometimes. Self-care is important. So on that note, self-care, coffee, my mug from Australia, Sydney. Hello, Tiana. She's asleep right now, I'm sure. So thank you for tuning in from Colombia. That's amazing. And thank you, Albert, for your comments and questions. And I appreciate everyone watching. Please leave comments below somewhere there for further topics that you want to discuss or need questions answered on, anything I can do to improve this whole thing. I'm going to be posting some videos coming up, just like not live stream, just videos, information, and whatnot. So that's coming. And the Skype is coming. I'm going to be talking to those who disagree with me on certain topics, and we'll see how that goes, because I think that opening the dialogue is super important. And I hope that you check those out too. So please subscribe, tell your friends. I want to keep doing this. I hope it's interesting. So on that note, and thank you for the follow, Albert. On that note, I will say adieu. Bye. Cheers.